Good afternoon, everyone, and welcome to the Cultivating Compassion Education series, sponsored by Compassionate Care ALS. I'm very fortunate today to have with us Dr. Shelena Lalji to do a very interesting talk for us that I think will be quite valuable to our audience today. So thank you for joining us, Dr. Shel. Let me say just a few words about our speaker. Dr. Shelena Lalji is a board-certified OBGYN with extensive experience in functional and integrative medicine, medical aesthetics, and regenerative treatments. After 13 years of practicing traditional OBGYN, she founded Dr. Shel Wellness and Aesthetics Center in Sugar Land, Texas, where she treats patients with a root cause, holistic approach, and integrative medicine. Dr. Shel is a sought-after international speaker, media expert, and trainer for physicians around the world. She's also the author of an inspiring book called I Am Woman, Our Journeys to Health, Happiness, and Harmony. In November of 2017, Dr. Shel's husband, Dr. Ayiz Lalji, was diagnosed with ALS. This would cause most to crumble, but Dr. Shel, alongside her family, turned it into a mission and created the Lalji ALS Foundation at alsheroes.com. In 2021, Dr. Shel and her family established an endowment at the Healy Center for ALS and began the annual endowed Lalji Family ALS Award for Innovation in collaboration with Mass General and Healy Center for ALS to identify and support ALS repair and regenerative research globally. Dr. Shel has also created integrative medicine protocols to help people living with ALS optimize their gut health, nutrition, lifestyle, detoxification, and hormonal health. She has helped numerous pals have hope and continue in this difficult journey. Thank you for being with us, Dr. Shel. Before we get started, I'd like to introduce our founder, Ron Hoffman, to say a few words. Welcome, Ron.
Yeah, thank you, James. Dr. Shel, thank you so much for being here.
It's my pleasure and an honor.
I met Dr. Shel some years ago, I think, and was really taken by the nature of the work that she does. You know, I've been familiar with functional medicine for many, many years. And yet, as I was getting to know Dr. Shel more and more and her relationships with other folks in the ALS community that I know very well and work with, I was incredibly taken with the nature of her work and the heart that she brings and the compassion that she brings and the knowledge that she brings as someone that's just not in the world of functional medicine, but how she integrates that with traditional medicine, and most importantly, how she's been tending to her husband along with her two children for 7+ years now. I needed to get to know this person, and I have, and I'm really grateful that she's here. She's an incredible collaborator of ours now, and actually a member of our ALS community. So I'm incredibly grateful to have her, and welcome to everybody. Dr. Shel.
Thank you so much. Thank you, Ron. Thank you, James. Thank you for an amazing introduction, but also more than that, thank you for the work that you all do. Thank you for serving this incredible community of people who live with ALS every day. The heroes, my personal heroes, all of them, the caregivers, the teams, the clinicians, the researchers. I am so grateful to be part of this group. And, it's like we say, there are no coincidences and everything does happen for a reason. And that's not what any of us want to hear when we get a diagnosis of ALS. But having been in this journey for several years, I truly believe that. So without further ado, I'll go ahead and get started and hope that some of the information that I share today will help you, your loved ones, and potentially the way that you might practice if you're a clinician. Let me know if you can see my screen, James.
Yeah, looking good, Dr. Shel.
Okay, sounds great. So like James said, I'm going to be speaking about a comprehensive and integrative approach to ALS. Why is this important? This is important because we really want to have more of an integrative approach, not just a functional medicine approach, not just a traditional medicine approach. Integration is where you're going to get the best treatments and the best opportunity to do the best. All right. So I'd like to just take a moment to mention some of our heroes. Of course, you recognize a lot of the pictures. We really honor the heroes who are amongst us who have chosen to claim their own destiny, and they've dedicated their lives to overcoming this common adversary, and that adversary is ALS. And we're ready to take it on. You see my husband and I over there, and then you see one of my dear, dear friends, Dr. Merit Sukovich, and her picture is here as she will come up a few times in this conversation because we need clinicians like her to really advocate for us and to really guide us in the right direction. All right. So we all know what ALS is, so I won't spend much time on this, but what I want everyone to understand is, yes, it is a devastating illness. Yes, it robs the body of everything that we can possibly have, all of the functions, to walk, to talk, to move, to swallow, and eventually to breathe. And it is so devastating for not just the person living with it, but also their loved ones, until we can find a way to heal our bodies. One thing that I always tell my patients is that ALS is like any other condition in that our bodies have been impacted by the root causes. We have come to this point because of a lot of dis-ease and imbalances and different kinds of trauma, and we'll talk about the plethora of causes and contributing factors in a minute. But we are able to heal our bodies if we give our bodies the right substances and remove the damages that have been done and remove the toxins that have potentially gotten us to this level at this point. A little bit about us, and Ron and James both mentioned my husband. Ayaz was diagnosed at the age of 51, and his progression was incredibly rapid. And back in 2017, we were indeed devastated with this diagnosis. And because of his rapid progression, we were essentially told that he would have about 6 to 9 months. And from that point, we are at about 7 years. And so I want you to take that with a level of hope, that there is hope when you try to take the right approach. There are no guarantees, but there is a certain way that you can proceed with this illness or any other condition where you are really focused on the root causes and do the best of everything that science has to offer, as well as lifestyle medicine. The problem truly is hopelessness, isn't it? We get a diagnosis, and a lot of times we're told that there's no cure, and there are 5 FDA-approved drugs now. When we were diagnosed, there was only one, Riluzole, and Radicava had just come out. You're given a life expectancy of 2 to 5 years, and we do know that we have thousands and thousands of lives that we would like to save, all of us together. The thing that I would tell you is we want to continue to have hope, because traditional medicine researchers and everyone out there is doing their absolute best to make this a mission for them. And you have to do your best to make your body and your mind a mission for yourself. And that's what I'm going to kind of educate you on today. How can you do your part so that everything that's being done out there can be best utilized in your body, which is indeed a miraculous being? Wherever you may be in this stage, whether it's early, middle, or late stage, it is something that you can still work on. Doesn't matter if you're in a late stage of ALS, doesn't matter if you've just gotten diagnosed. The same principles apply of getting your body to a state of healing. And that's some of the things that we're going to be, again, discussing today. All right, so wouldn't it be great if I told you, hey, here's a pill, take it, and you can reverse ALS? Well, Unfortunately, that is not true, and that is not what I'm going to be telling you. It is hard work, it is commitment, it is dedication, and it is belief. It is positivity. It is the practice of gratitude. It is the practice of mindfulness. It is being present. It is being aware, being educated, all of the above. All of those things are incredibly important for you to do the best that you can in this journey. So what is functional medicine? Like I've always said to my patients, our bodies are nothing short of miraculous. But we have to look at the root cause of dis-ease. So the next time you hear the word disease, think dis-ease. That's what it truly means. There is a dis-ease in the body. There is an imbalance in the crucial areas of our bodies. Once we start balancing those crucial areas, the body truly is capable of healing. You have to believe that, and you have to know that. However, that's not where it stops, and I'm going to give you the full picture in the next few minutes. All right, so let's talk about the integrative approach that I normally use for my patients, and just whenever I'm, sharing information and sharing knowledge to people who are really wanting to do the best for themselves. But in ALS specifically, is it truly ALS? Have you gone through an appropriate diagnosis? Did you go to an ALS neurologist, hopefully a multidisciplinary clinic? And was everything else ruled out? And so now, if you know it's ALS, what's the next thing you're going to do? You're going to look at what are the potential causes, what are the potential triggers and or contributing factors. Why is this important? You'll find out in a few minutes that there are a plethora of causes and every single person is unique. And so you really need to know what potentially caused it in you so that you can address those issues and get those behind you. So that needs to be explored with testing, with imaging, with other things. Then we're going to harmonize all of the test results and then the lifestyle modifications. We're going to look at all the treatments that may be available to us from conventional medicine as well as functional medicine and combine both of those. We're going to revitalize our body so that we can slow down the progression and start healing on a cellular level. And then hopefully, as science moves forward, and there are many different things going on right now, as you all know, using iPSC lines, using stem cells, hopefully one day we'll start improving function, leading to potential reversal. And this is our hope, and this is what we're going to continue believing in. So I want to give a shout out to our good friend, Dr. Richard Bedlack, who has now to date reported 60 ALS reversals. He's from Duke University. Most of you have probably heard of him. If you have not, please do go look at his work. Go look at ALS Untangled. The reason that I really mention this every time I speak is because there is hope of reversals. And so these are patients that Dr. Bedlack has confirmed were ALS diagnoses and done chart reviews. And now what they're doing is utilizing AI to really see what the commonalities are, what contributed to some of these reversals. They're actually also doing some genetic work to see, using genomics to really see what kind of potential causality and contributing factors there could have been, and then customizing some of the treatments. So there's a lot of work being done. I would highly recommend, I've given you a link over there on the screen, highly recommend that you go look at that and listen to that latest information. So there are some important considerations that we need to talk about. One, if you are a person living with ALS, you need to work on getting your body optimized because it needs to be optimized to heal. If you're a caregiver, make sure you're taking care of yourself. Self-care practices, I'll talk a little bit about this later. And if you're part of the community, then let's get involved, let's get heard. If you're not part of the community, become part of the community because we need to have a voice in getting a cure right around the corner. So I'm going to give you just an overview of 8 steps that I'm going to be talking about for healing. The one thing that you need to, and this is going to be a slightly different approach than a lot of people that you might have heard or Some people might say, well, when you're practicing functional medicine, you don't believe in any kind of traditional medications. I completely disagree with that. You have to integrate the approach. You have to do the best of both worlds. So number one, whatever is indicated as far as FDA approved meds, you want to look at that. You want to look at your hormonal balance and utilize natural bioidentical hormones to replace what is deficient and what is imbalanced. Again, a lot of these things, I am going to go into it in more detail, but I'm giving you an overview right now. Hormones, nutrition, the gut microbiome, detoxification and exposures to toxins, adrenal balance and stress reduction, movement, activity, range of motion, and lifestyle, reduction of stress, sleeping well, meditation. All of those things are very important, and we'll dive deep into those. So knowledge is everything. It all begins with knowledge, and that's why you all are here today, because if we know better, we'll do better. And, Oprah said it, so we got to listen, right? The first thing that we did when we first got diagnosed, and always you'll hear me say when we got diagnosed, I don't believe a person gets diagnosed. I believe a family gets diagnosed. We are all in it. Our entire life changes. You can't just say, well, this person got diagnosed, but our life will continue to carry on the same way. It won't. You all know this. So a family gets diagnosed, and it's a family affair to really dig in. It's really important from a scientific perspective as well as a personal perspective to realize that neurodegenerative diseases fall under this one umbrella, and there's a lot of commonalities between a lot of them. So it's important to study the different ones, and a lot of this is being done with the scientists looking at the different commonalities and what might have worked in Parkinson's. Okay, do we want to try this here in ALS? How about multiple sclerosis? How about polio? A very similar presentation. But where's polio? Well, we were able to get rid of that with some antivirals. And so we've got some studies being done on retroviruses. There's a lot of work being done in these different areas that are going to be applicable in ALS. And that's the beauty. Collaboration between the different fields. And that's one of the things that our foundation tries to work on. All right, so let's jump in to what are the possible causes of ALS. Well, looks like a very complex screen because it is very, very complicated. So let me try to break it down for you because there are a plethora of different causes and contributing factors in ALS. And I always say contributing factors because nobody really knows, and there is not one single cause. Why is this important as I'm speaking about functional medicine and integrative medicine? It's important because, again, we need to go and find out what caused or contributed to the ALS in you as an individual. And that's where the root cause comes in. All right. So was it inflammation? I would probably say that inflammation and neuroinflammation is probably across the board, either in the beginning or towards the middle or end. That's going to happen. So you need to be thinking inflammation. What am I going to do for inflammation? Gut microbiome. Studies have been done where it is a very important part of what's causing and contributing to ALS. We'll talk a little bit about that. You might have heard things like leaky gut. Do you have dysbiosis? You want to look into that. Oxidative stress. It is going to damage the cells. What do we need to be on? Things like antioxidants. You need to be thinking about antioxidants. Do we have disrupted intracellular transport? Do we have autoimmune component? Do we have any other autoimmune conditions? And if we do, then, hey, perhaps we have more of an autoimmune component that might have contributed it in me. You need to think about that. Misfolded proteins, we know there's a lot of work being done with TDP-43. The mitochondria, what is the mitochondria? It is the battery pack for our cells. It is what's going to give us energy. And so when the mitochondria is dysfunctioning, you're not going to have cellular energy and the cells will break down and then lead to inflammation and many other things. Toxins. We all know we are living in a toxic environment. It's everything around us seems to be toxic. But what are we exposed to more than the average person? Do we have a mold-infested home or workplace that we're working in or living in? Do we have candida overgrowth? Because we know candida can lead to neurotoxins, brain toxins. Were we exposed to parasites, BMAA, Do we have amalgams in our mouth? Were we exposed to a lot of lead? These are things that are important to know because it becomes really important when somebody like me or another provider or another practitioner is taking your history. You need to be thinking about these things. The other things that can contribute, of course, is have you had any recent physical trauma, broken bones, a fall, an accident? Have you had some intense emotional trauma? Did you just go through a loss, a grief? Did you lose somebody very special to you? And did you just go into massive depression after that? Did you just have something very, very life altering that happened? Are you exposed to a lot of EMF toxicity? Well, we all are. We all have the cell phone around us nonstop. Put that away. Turn off the Wi-Fi as much as you can, at least when you're sleeping at night. Put the phone away from you. Don't put the phone right next to your brain. That's pretty obvious. We all know these things, but are we thinking about these things? Are we thinking about these things potentially contributing to ALS or anything else that you might be going through? But today we're talking about ALS. And remember, you are unique. Every person with ALS is unique. There is not one cause or one contributing factor or not a 3 or 4 that everyone is going to have. It's going to be a different combination of the different ones. And that is why we need to get to the root cause of what was contributing to this illness in you as a specific person, because this list does go on. All right. So let's talk a little bit about the microbiome. We know that there is a huge gut-brain connection. It's really interesting, and take note of this. There are more neurotransmitters in the gut than there are in the brain. This is very important. Think about the gut being in direct communication with the brain. The microbiome is extremely important, and it's impacted by everything. It's impacted by your genetics, by your environment, what you're eating, what your lifestyle is, your stress, your hormones, what kinds of things you're exposed to. And then it goes and does what it needs to do in the rest of your body. So the microbiome is extremely important. And the good thing is, scientists and researchers are doing a lot of work on the microbiome. That is fantastic because we want to see this. In functional medicine, we've been talking about the microbiome for decades. And now with all this research that's coming up, we're actually seeing that it has been shown to play a very crucial role already in conditions like Crohn's and IBS and Parkinson's. We've seen that the microbiome is very different in ALS patients, and this is noted by several different studies, than a person who does not have ALS. There's a lot of research being done on a specific one called akkermansia, and it's been shown in F.A.C.O.G mice that it actually increases what's called nicotinamide. A lot of you might know this as NAD, and it actually improves motor function when these mice get akkermansia. So this is something that is all the dots are being connected, and perhaps you need to know what your microbiome looks like and what's going on inside your gut, and make sure that you decrease the gut inflammation and you decrease dysbiosis and leaky gut in yourself. And of course, we'll talk about how to do that. But it's very important. I wanted to make this strong point that you do have bacteria that secrete neuroprotective products. You want more of those. There are bacteria that secrete inflammatory products. You want less of those. There are bacteria that can secrete toxic substances. You want less of that as well. So much so that there's actually some work being done on fecal transplants, and we'll see what the studies show. But what we're trying to do is get healthy microbiomes into patients with ALS with the not very healthy microbiomes. So there's a lot of great hope there. All right, so now I've given you all of these causes, all of these contributing factors, super confusing. What are we going to do now? So what we're going to do now is we're going to try to figure out, how do we know what is happening in your body? And this is how we do it in our patients with functional medicine. So where do we start? When I take a look at my patient, whether it's an ALS patient or somebody who's coming in with cancers or autoimmune conditions or anything else, I always start with an extensive history. And this is really, really important, because if you don't know, how can you treat and how can you assess? And this is the trouble sometimes that, when I was in traditional medicine, and accepting insurance and what have you, I'm sad to say I would have to see 20 to 25 patients a day, which running into deliveries and, going into emergency surgeries and also seeing patients, that leaves you with about 10 to 15 minutes per patient, which is not enough. That was one of the main reasons I went into more integrative medicine and functional medicine so that I could do what I thought was the best for my patients, which is really dive deep into their root causes and be able to do things that I will mention today. Your stress history is very important, first of all. You want to know what your sources are. Is it family life? Is it work life? Is it other things? Is it your past? Is it your traumas? How are you sleeping? Sleep is the only time you're going to actually heal your cells. Deep sleep is what you need. Are you sleeping 8 to 9 hours? And most people say, no, they're not. They might be sleeping 5 to 6. That is not enough. Do you have any emotional traumas? Have you dealt with them? Do you have a family history of ALS or even other neurodegenerative diseases? Because if you do, that needs to be addressed. And again, this history should be taken not just by your functional doctor if you have one, but also by your ALS neurologist. And I'm happy to say that most ALS neurologists are diving deep into this history and taking the time. If you feel like you have somebody who's not diving into this history, then that's the time that you're your advocate and say, hey, I want to talk about all of these elements with you because it may be pertinent. What I'm going to leave you with is a couple of messages, and one of them is be your own advocate. Sometimes we as patients have to teach the physicians what we need, and that's okay. And if the physician, like, myself and many others that I know in the ALS world, they will be very receptive to it because we just want to do what's best for our patients. So be your own advocate. Do you have any gut health symptoms? Bloating, gassiness, reflux, cramping, constipation, diarrhea? That's important because that tells me that you've got some inflammation going on and probably have some issues with your microbiome and leaky gut. What is your eating plan? Have you been eating inflammatory foods for the last few decades? Do you drink a lot of alcohol? How's the caffeine intake? Do you exercise excessively or not at all? Any extremes are not good. Do you meditate? Do you do anything about those stressors? Have you had any recent physical traumas, broken bones, falls, etc., like I mentioned earlier? Have you been exposed to some of the toxins we spoke about earlier? And what kinds of prescription drugs are you taking? All of these things are very important, not only for you to know, so feel free to take a picture of the screen, but also for your practitioner to know so we know which areas to really delve deep into. The next thing is, please make sure that you've been to a multidisciplinary ALS clinic. I am always going to say that it is very important for you to do that. You cannot be listening to people who might say, oh, well, traditional medicine doesn't have anything, go all functional medicine. Completely disagree. You need to have the best of both worlds. Make sure you've had a detailed physical and neurological exam by an ALS neurologist, have had all the imaging studies that are pertinent for you, and have had customized and extensive laboratory evaluation. All very important data on which to build up your next steps. All right. Again, if you're a person living with ALS, you need an integrative approach, you need an expert team. When you go to a multidisciplinary ALS clinic, you will be educated on trials. Platform trials are something that you need to really be educated on. Watch the latest YouTube by Dr. Marzukovic, where she overviews all the platform trials. Very important to know what's out there. What is something that you would qualify for, and what does your gut tell you? You have to start listening to the root causes, the gut, the data, the testing, but you've got to listen to yourself. But you need the education and information first. You also will have options for different FDA-approved meds if you're under the care of an ALS neurologist. And when you go every 3 months, you'll be seeing, if appropriate, a GI doctor, a pulmonologist, physical therapist, occupational, respiratory, speech. All of these things are very important to keep tabs on what's going on with your speech, your swallowing, your breathing, your respiratory function. So I highly recommend that you do that in addition to anything else that you want to do. Your functional medicine team is going to help you identify root causes and imbalances and get you to the point of healing your body so that your cells can start healing and you get to the best place where some of these medications may actually work for you so that you don't have a toxic environment. So you need that guidance and you need that hand holding if you can't do it yourself. And then, of course, mind-body medicine. If you're dealing with trauma, make sure that you have a therapist who might do cognitive behavioral therapy or a psychiatrist if needed, and potentially a meditation guide. All right. Again, just as an overview, integrative wellness, and I'm not going to go deep into this because I've already mentioned, you need to have all three areas combined to do the best. So let's dive into testing. All right. So some of the first testing that I like to do for my patients is, like I said, gut. We've got to focus on the gut. It's a very important place to start because most of us have inflammation in the gut, and we know microbiome is very important. There are some tests that you can do depending on who your provider is, how long they've been practicing, and what tests they like. Some of the good testing companies are Genova, DDI. You can look at any of those companies. Those are all good functional medicine companies that will give you the good data that you're looking for to let you know if you've got inflammation, if you've got dysbiosis, if you've got toxins, if you've got ova, if you've got parasites in your system with doing a stool test. The next one, I always like to look at food sensitivities. It doesn't matter what we think is good for us, because we might think we want to eat just, chicken and turkey and spinach and broccoli, etc. But when you actually do the test, you can see what food substances might be triggering inflammation in your body. So it's an IgG test for over 200 food substances that tells you, because we don't have time to waste. We don't have time to do a, elimination diet. Oh, I didn't feel good with this. Let's do this diet. I didn't feel good with this. Do the test, find the results, and then work accordingly. And again, it just depends on where the patient and doctor communication is. If that's something that works for you, great. If it doesn't work for you, then elimination programs are fine too. ALS is a good lab for this. Genova is a good test for this. Candida overgrowth is important because we live in a very antibiotic happy culture and a sugar happy culture. So if you think about what you've eaten for the last 40, 50 years, it's probably going to be sugar, processed foods, and foods that we probably should not be eating. And any sign of a sinus infection, we're on antibiotics. Any sign of a flu, we're on antibiotics. What the antibiotics are doing, and I'm not against antibiotics, but an overuse of antibiotics will eliminate the good bacteria along with the unhealthy bacteria. And then what will overgrow? Fungus, candida, yeast will overgrow. Like I said earlier, candida is toxic to the brain. So you need to know if you have candida overgrowth. That's very easily diagnosed with a simple blood test with ALS or even with LabCorp. So you can do any of those. I already talked about the comprehensive stool profile. You want to look at inflammatory markers to see how much inflammation you have in your body. And then, of course, the general health screening that I'm sure you'll have done at the ALS clinic as well. But out of this, you have to make sure that your vitamin D3 level stays high. You want that level to be between 70 and 80, not 30 to 40. 30 is sort of the low limit of normal. Between 30 and 100, you don't want to be just barely in the range. You want to be optimal. Everything I speak about today is how to optimize your body, not just be barely alive. So vitamin D3 is very important. And remember, your fasting insulin is very important because if you're insulin resistant, you're not going to heal. You're not going to be in a healing mechanism. So that's very important. All right, other things to test for. And a lot of these tests, whatever tests, so in my practice, we always give the patient the opportunity to be as much cost saving as possible because things get expensive. And one thing I'll tell you is I think financial stress is a real thing in ALS. So find a practitioner who can work with you and who can give you the ability to utilize your insurance as much as possible, wherever possible. So definitely look at your endocrine levels, look at your sex hormones. You want to look at your testosterone. If you do that, and you should, look at a free and total testosterone. If you're a male patient and your testosterone is in the 200s or 300s, and ALS is going to impact your muscles, well, you're not going to have any strength of your muscles, your motivation, your strength, your energy, your mental clarity. Testosterone and DHEA are very important hormones for that. Even for females, testosterone is very important. If you're in the tank, it is something that should be considered when you're doing bioidentical hormones. And we always customize hormones for our male and female patients. It's very important. And of course, looking at estrogen, progesterone, DHEA, and all of it together. What I tell my patients is hormones is like having a symphony orchestra. You need every single instrument to play beautifully for the symphony to sound beautiful. If one of your hormones or a few of your hormones are not balanced, you're not going to function well. So it's really important to get things in harmony and in balance. The other area that's very important is your adrenal hormones. Now, what are adrenal hormones? Your adrenal glands are sitting on top of your kidneys, and those glands are responsible to secrete cortisol, which is your stress hormone. Stress hormones can put you in complete havoc. And when you're stressed, when you're in a fight or flight mode, guess what? You're not in a healing mode. You can't be activating a sympathetic state, which is your fight and flight, and a parasympathetic state, which is rest, healing, and relaxation at the same time. It's either or. So you've got to switch from fight or flight to the parasympathetic state. So you need to look at what is your circadian rhythm showing. And I like to do that best with a salivary cortisol level 4 times during the day. I put the lab down that you can just contact yourself if you like and get a test kit. Complete thyroid panel. This is very important because I'm sure everybody's been to their PCPs and they've done your testing on your thyroid, and they've tested a TSH and a T4. 99% of the time, that's what's being tested. That is not what you need. You need TSH and T4, but you need a free T3, a reverse T3. You need to look at your thyroid antibodies. You need to see if you have autoimmune thyroiditis called Hashimoto's thyroiditis. Because if you do have autoimmune thyroiditis, chances are there's an autoimmune component to your ALS as well, because you've got these autoantibodies swimming around in your body. So these are things that, again, will let the practitioner and the clinician and even your ALS neurologist kind of, connect the dots and see what may be causing it in you. Neurotransmitter levels are indicated if you're going through a lot of anxiety, depression, uncontrolled, PTSD type of issues. That is where that becomes important. So these tests are really important, but again, they should be customized based on your history. The other things that we look at and that are very important to look at is nutritional deficiencies. Why? Because we eat foods that, even if they're organic, they don't have the same nutritional content than they did 50 years ago or even a couple of decades ago. The soil isn't the same. There's chemicals and pesticides everywhere. So you're probably balanced nutritionally. And that is very, very important. So we look at nutritional deficiencies. We look at your oxidative stress markers because we are all exposed to oxidative stress. We look at essential and metabolic fatty acids. We look at mitochondrial metabolites. We look at organic acids to be able to put together this picture of what are the nutrients that you need. I will later on give you a list of things that a lot of ALS patients like to take, and they're all great supplements, but you don't want to take 30 things. You may not and probably don't need 30 things. You need to take what you need based on what your deficiencies are. And that's the only reason that we do these testing, is to customize your protocol. There are some labs that I've put on the screen there. To look at methylation is also very important. And to look at your toxin level is very important. If you've had some exposures, Lyme disease. A lot of the ALS clinics will check you for Lyme disease. You need to know that some people may have Lyme disease, but everybody with ALS does not have Lyme disease. So check. If it's negative, great, move on. Don't get hung up on things that you hear out there, and don't try to do expensive, extensive protocols to eliminate something that's not even there. All right. So moving right along with the testing, a lot of these viruses will be tested for when you get your ALS diagnosis. That's the good news. Just make sure that they are tested for and you know what's going on with them. Because if you have Epstein-Barr virus, for example, and you're a carrier and you have an acute if you have IgM levels, not just IgG levels, then you need to address that because you've got an outbreak of this overproduction of different viruses. And it may just be due to stress and other things, but this is something that needs to be addressed. Mycotoxin panel looks at mycotoxins and mold, and there's a couple of labs that I've mentioned for that, because again, a lot of people can get exposed to mold, and that does wreak havoc on your bodies as well. Any kind of toxin can wreak havoc on your body, and so we'll talk a little bit about what to do with it. But I'm going to say this again, and I've put it in bold. Don't spend your life savings on testing. If you cannot afford it, there are ways of going around it, possibly. But you can still customize based on root causes, based on symptoms, etc. I want you to remember, knowledge is power, and I'm giving you that knowledge right now. However, you don't have to take on everything, and especially you don't have to take on everything at once. But it's good to know the overview and then decide what works for you and your family. All right, so much information. What do we do with it all? So let me try to put that together for you so you can have some take home. All right, so what are some of the approaches in ALS treatment and in research? As you see, there's a lot of things being researched, focusing on the motor neurons, antioxidants, anti-excitatory, anti-inflammatory, et cetera, and the list goes on. What can we do as people living with ALS while the researchers are doing this great work? Well, it's a precise process. So I want you to start thinking about ALS like a forest fire. Everything's burning down, and it's quick. We all know this. When a practitioner gives you 2 to 5 years, to live, or in my husband's case, 6 to 9 months, it's a forest fire. It's burning everything down in its path. But first, we have to find the source of the fire. And that's what we're going to try to talk about. That's what is the source of the fire? What triggered that fire to begin with? That's your root cause. Then we've got to stop the fire, stop where it came from, and stop it everywhere. So stop the neuroinflammation, stop the protein misfolding, the glutamate toxicity, the destruction, the microglia, the mitochondrial stuff. We have to try to stop that oxidative stress. And then, only then can we rebuild this beautiful forest, which is our bodies and our motor neurons. Okay, so think about it in a way that makes sense to you, because I'll tell you, I'm here today to share this information, but I did not know this information 7 years ago. What allows me to do this for you is the fact that I've made my own mistakes and treating my husband, because our heads were spinning. We were like little, we were in just this little rut of trying everything. And then it was only a few months into it when I said, okay, honey, we got to stop everything and we got to breathe and we got to take a step back and we got to just tell ourselves, okay, we are going to do this very systematically. And it was when I started doing systematically that we had the best results. And that's what I'm sharing with you. Do things systematically, not like you're in this rut and you have a clock to beat. Yes, it is hard. Yes, it is devastating, but you're in a much better place today than we were 7 years ago. And so listen to everything that you can so that you can put it together for yourself and your loved ones. Okay. I bring this slide up because I made a list for you of the 5 FDA-approved medications that are great. If it's indicated for you, talk to your ALS neurologist about it, and please take advantage of what's out there, right? Everybody I see, even for the integrative medicine, I always make sure that they have an ALS neurologist, they're going to an ALS multidisciplinary clinic, and they have been spoken to about all of these medications. If they haven't, I speak to them about it and have them go back and get a prescription if it's indicated. All right, gene therapies are also something that's very important and very, very powerful. There's a lot of work being done on this, so please make sure that you have had your genetic testing done, that you have the sequencing, the genome sequencing done, because if you do have one of the genetic mutations that are being worked on, then you could definitely benefit from one of these therapies. All right. So before I go into how we're going to rebuild this forest, I want to just take a moment and tell you a quote by one of my favorite authors, Rumi: "Where there is ruin, And ALS is ruin on the body, but where there is ruin, there is hope for a treasure. So remember that and just take that in for a second. All right, so how are we going to stop the fire? First and foremost, you're going to get rid of those toxins. All right. Any environmental toxin that you can get rid of, whether it's your cleaning products, whether it's your personal products, whether it's the pesticides that are used in our homes, gardens, lawns, whether it's mold that we might have in our homes, get rid of it. It's an easy process. It takes a little time. It'll take you maybe a few weeks or a month, but it's a process that is worth doing. If you have kids, they will learn so much from this process, and you'll know that they will always live toxic free. We did this about 6.5 years ago. Our entire home was cleaned out. Now my kids never order anything that are toxic personal products. And at least I know that through this experience, they will lead healthier lives. I've put 2 websites that might be useful to educate yourself on that and maybe do whatever you want with that. But there's many, many products out there. Biologic dentistry. Why is that important? If you think about it, in the field of dentistry now, they never use mercury fillings. Why? Because they're toxic. They're toxic. They have always been toxic, but they didn't know that. So even for my husband, being a dentist, he was always around mercury. He had 8 amalgams, 8 mercury fillings that he got at the age of 18, because unfortunately, that was the least expensive filling at the time. And he didn't have money at that time. So that's what he had. But when he was diagnosed with ALS, one of the first things we did is we got them removed, because you don't want the exposure of any heavy metal like that inside your mouth, which is very close to your mind and your brain. So getting rid of toxins is very important. And if you do that, please find a biologic dentist. And if you need some referrals, just email us later. All right, so the other kind of detoxification that you will do, gentle detoxification. You don't want to do anything that is aggressive and harsh on the body, because think of an ALS body as being, it needs gentle care. All right. So I usually start my patients on a very gentle 14-day detox, not for weight loss. It's very important to remember, do not lose weight in ALS. You're already in a hypermetabolic state. So you need to make sure that you're eating enough nutrient dense and calorie dense food, but the right foods. So you're going to eliminate all the things like gluten, sugars, dairy, processed foods. All of those things will get eliminated, and get rid of inflammatory foods. You want to detox from stress. You want to consider something warm, like an infrared sauna, so you can sweat out a lot of the toxins that we're constantly carrying. Think about light therapy. Think about foot detox or hand detox. Think about doing some detoxification supplements, such as binders, such as chlorella, such as glutathione. Those are great detoxification supplements to detox your body. And there's another really good one called castor oil. A lot of you might have heard of it. If you haven't, I've got a podcast on it on drshelinstitute.com. Please listen to that. But castor oil packs are great to detoxify your liver, your gallbladder, and your GI system. So easy, not expensive ways of detoxifying your body. All right, so as we're rebuilding the body, rebuilding the forest, we want to make sure that food is our medicine. Food needs to be our medicine. We've known this since 400 BC. So let's kind of dive right into that. Eating clean, like I mentioned, extremely important. Avoid inflammatory foods, and I've listed them a little bit earlier. So no artificial colors, flavors, sweeteners, dairy, alcohol, all of that. If you decide you want to do a food sensitivity test, you'll dive deep into 200 different foods. But if you don't want to do this test, that's okay. At least eliminate these inflammatory foods to start with. Introduce healing foods. What do I mean by that? Increase foods that are natural in prebiotics and probiotics. That would be a lot of your fermented foods, and I'll list some a little bit later. Get your body alkaline. How do you do that? Easiest way, not expensive. Get some organic apple cider vinegar, get some fresh lemon, squeeze that in a cup of hot water, start your day with that. You're going to shift your acid-base balance to more alkaline, which is more healing. Acidic invites disease. Alkaline invites healing. Again, weight loss is not your friend. I'm going to say this a few times because when I don't want any misinterpretation of clean your diet and start losing weight. No, what I'm saying is you need a calorie dense, nutrition dense, good fat dense diet, which is non-inflammatory. So you're not trying to lose weight. It's not your friend. Make sure you have a daily bowel movement at least one time, preferably 2 or 3 times. Think about it this way. I'm not trying to get too graphic here, but whatever should have been in the toilet is sitting in your gut and it's creating more toxins. It needs to be out. So whatever you need to do, and there are some great supplements if you're not going, make sure you're hydrating. Rule of thumb, take your weight in pounds divided by 2. That's the minimum amount of water you need to be drinking. Hydrate a lot. That's going to help you detoxify. It's going to help you be regular. Very important. So have that daily bowel movement, take some magnesium, take some other supplements that we can talk about later. If you see that you have parasites or candida through any of your testing, you need to treat it. We don't want to leave that in our body. There are some natural ways of treating candida. If you don't want to get on antifungals, you can do oil of oregano, you can do caprylic acid, you can do apple cider vinegar, berberine. All of these supplements can treat candida in your body. And you want to have a digestive supplement support protocol. What do I mean by that? As we age, everything decreases, right? Our glands are not going to produce as much hormones. We're not going to produce as much enzymes. So you might need digestive enzymes to help digest the good food that you're eating so you can absorb the nutrients. So digestive enzymes, proteolytic enzymes, and things like L-glutamine powder to really rehash and rehab the gut. Rehabbing the gut is very important. If you do show with any of the testing that you have leaky gut or dysbiosis, or if there's a microbiome issue. So those are some tips that you can do with spending very little and really just be able to do it at home. All right, so a couple of other tips to treat the gut with food. What kinds of things can give you prebiotics? Simple, jicamas, onions, asparagus, apples, leeks. Those are all important sources for prebiotics, which will fuel your good bacteria, which you need, so you can create your own good bacteria. And then probiotics can be gotten from fermented foods like kombucha, kimchi, kefir, sauerkraut. And with this, you can help repopulate the gut microbiome. Very important and easy to do. Omega-3s are very important to reduce the inflammation in your gut. Digestive enzymes, we already talked about, and then healing the lining of the gut with L-glutamine. Those are some easy things that you can do. Now, let's assume your gut is good. Your gut is balanced, and we want to look at nutrition. And again, I'm not saying that it should be done one at a time. You need to be doing this simultaneously, but don't overwhelm yourself. If you're somebody that gets overwhelmed easily, start with the gut and then build upon it, because you want to start with getting rid of the toxins and building the gut. When you look at your nutritional status, you definitely want to think about a customized protocol, which is best with testing. But if you choose you don't want to do the testing, or if it's too much for you, or you don't have access, or whatever the issue might be, you want to think about certain different areas that have been looked at in ALS specifically. Oxidative stress is looked at, neuroinflammation is looked at, mitochondrial dysfunction is looked at, disrupted transport and autophagy is looked at. So you want to think about what kinds of supplements would be appropriate for those areas that might have been a contributing factor for you. Again, testing is important, but it's not required. So you want to look at some antioxidants. You want to look at some mitochondrial support supplements. You definitely want to make sure that you're balanced as far as your electrolytes and minerals go. You want to think about cannabinoid oil, CBD oil, but quality and purity really matters here. We used it quite a bit and still use it, because when my husband was first diagnosed, he had a lot of spasticity and a lot of pain, a lot of cramping. And we felt that it was very, very helpful, both orally, sublingually, as well as topically. So just a couple things that I can share from our own experiences. Brain vitamins, brain minerals, brain mushrooms. There's a lot of healing strength of the appropriate mushrooms. I'm not talking about shrooms. I'm talking about mushrooms. All right, there's a big difference there. Stress reduction and neurological support. Those are very important areas that you want to think about for nutritional supplements. I am going to show you sort of a list, but that by no means is this list anything that you should go out and get. I'm going to show you a list of certain supplements that can address certain things that I've discussed right now. So many different things here. Of course, TUDCA and sodium butyrate, you know that that is what Relivrio is. So if you're on Relivrio, awesome. And if you're not, talk to your practitioner about getting on Relivrio. Curcumin is a great antioxidant. MitoQ is wonderful mitochondrial dysfunction. And the list goes on. So you see NAD there, you see Protandim, you see probiotics and prebiotics, you see GABA and L-theanine if you're having trouble sleeping, if you're having trouble with stress and anxiety. You see glutathione there, which is a powerful antioxidant. You see N-acetylcysteine, which is a precursor to glutathione. You see vitamin D3, and one thing I'll tell you about vitamin D3, for it to get absorbed well, you need to take it with K2. So make sure you've got a supplement that has both combined. You see many other things, the B vitamins, which are methylated if you have a methylation issue. You see alpha lipoic acid, which is another strong antioxidant. So you see things here that are options that, again, I want to be very clear. You don't need to be on 15 to 30 different supplements. You need to customize things based on information and based on what your providers, practitioners, and your own gut tells you, okay? Listen to yourself as well. If your gut is super inflamed, chances are you're not going to absorb oral supplements. And the other thing I want you to know is oral supplements or over-the-counter supplements from places like Walgreens and Walmart, and I'm not dogging anyone, but I'm just here to say there are nutritional companies that are actually looked at, and those supplements are evaluated and tested versus there are other companies that are not tested. So make sure you get your supplements from companies that are tested and are medical grade supplements rather than just over-the-counter supplements. If you're going to spend money, even if it's $2 on a supplement, you want to make sure it is something that you can absorb, that has what it says it has, and has the absorbability and free of other ingredients that you don't need. All right, so that's the little thing on supplements that I want you to keep in mind. All supplements are not created equal. That's why it's a multi-billion-dollar industry and a lot of supplements don't work. So please be cautious, please be careful. And that's a different lecture altogether, so we don't have time for more in depth about that. I'm just mentioning a couple of IV support that, some of you might have questions about. There's different IV therapies that are all vitamins and minerals. And I suggest these for people who have difficulty absorbing because they have a lot of gut inflammation. And if you want 100% rapid absorption with antioxidants, vitamin C, if you're getting sick, if you need an immune boost, things of that nature. So if you have heavy metals, then you might want to consider, but again, don't ever do this without medical supervision. There are ways to do safe oral and or IV chelation only if indicated and only if necessary. A lot of people are already on the methylcobalamin injections because there was some work done on that in studies and show to increase strength and energy for ALS patients. All right, so we are going to next go to correcting endocrine abnormalities. I spoke about this a little bit earlier, so I'm not going to spend too much time on it, but we already talked about you want your thyroid to be optimized, and I'll just give you a quick overview on that. So you want to get a detailed testing, and you can get that with even your primary care doctor, just using your insurance, but insist that you want all of those tests done. And you want to make sure that you are being treated for optimal correction. What does that mean? When you look at a TSH, it ranges in any lab will range from about 0.4 to 4.5. That is a very wide range. You want to be optimal, which is going to be about 0.4 to 1.5. These are just some numbers you might want to write down, but read more about it. That's a completely different lecture, just thyroid and adrenal optimization and how we do that. But just find the right practitioner who has the right experience to be able to do this for you and help you do this. I did put in cell regeneration, and the reason I put that in is because I think it's important for everybody to remember that you don't want to run at the outset of a diagnosis and say, I want stem cells, where can I get stem cells? And you're willing to pay $100,000 for it. Please don't do that. The reason I don't think you should do that is because it is very important to get your body in a healing state and in a place where it can receive anything that you give it. If you are fully toxic and stem cells are going into your body to basically create more and replicate, what is it going to replicate? Toxic cells. And also, we don't have any incredible stem cell treatments that we know are truly, truly working at this point. Don't use your body as just a, as a trial place. Don't do that, because it's important to do what you feel like you want to do what you feel is right, but really, truly look at what the science is showing and what the research is showing, and make sure that your body is ready to receive anything that you're going to give your body. Speak to your ALS neurologist, listen to all the lectures, listen to the studies, follow the studies, and then make a very, very safe decision and a well-educated decision thereafter. Okay. All right. So some of the stuff that I mentioned, a lot of the scientific stuff, and I'm going to talk about some of the lifestyle stuff, which is stuff that everybody should be doing on their own. You don't need to see any practitioner to do this, but this is very important. Activity is important, but safety is key. So if you want to be active, make sure that if you have trouble walking, you need a walker, please use it. If you don't have trouble walking, then absolutely, but don't do anything to exhaustion. But I am a big fan of exercise, exercising mildly so that you're not exhausted, but you're getting the endorphins going, you're getting the movement, you're not letting your muscles get very tight, and you're not exhausting yourself. Physical therapy, stretching to maintain joint mobility. We stretch and do range of motion on my husband at least 4 times a day, if not more. Very, very important to do that. Massages, routine massages with organic coconut oil has shown a lot of benefit. Other things, acupuncture, lymphatic drainage, sleep hygiene. Very important to incorporate these things into your lifestyle and make sure that you are doing some of the neuro rehab if you're losing some function. Like I mentioned earlier, the PT, the OT, the RT, the aqua therapy, speech therapy, very important. Please take advantage of those things, because hopefully you can keep the function going on much longer than otherwise. I'm going to do another little, pointer here for sleep. If you're not sleeping 8 to 9 hours of deep sleep, we need to change that. We need to change that right away, because you need your deep sleep to heal. Okay. All right. Any energy healing protocol, anything that you enjoy doing, whether it's meditation, mindfulness, gratitude journals. There's so much study, so much research in that when you are grateful. And I know when you get diagnosed with ALS, it's really difficult to be grateful. But gratitude puts you in a very healing stage, which allows healing to occur, which allows your cells to actually respond to the things that you're going to be doing. So try and be grateful for anything and everything that we do still have. I'll tell you, from our perspective, I, in the initial stages, was meditating anywhere between 2 to 4 hours. Even now, it's hours of meditation, hours of listening to positive messaging, positive music, elevating energy, frequency music. All of these things matter because you're going to be in a parasympathetic state, which is the only state in which you can heal. So I've listed a few things that are really important. Please choose whatever works for you, whatever appeals to you, but do something to get yourself in a very calming and very peaceful state, whether it's any kind of prayer, any kind of mindfulness, time with family and friends. And if you don't want to, engage with somebody, there are some great apps I've put on the screen. One is Calm, Insight Timer, Down Dog for yoga. All of these apps are either free or very little bit, and you can do this at home without even leaving. And your kids, your family, your caregivers, all of them will benefit from you being calmer, but also they'll learn to do the same for themselves. Mental health is very important, everyone. The reason it's very important, and like I mentioned, you just can't put a price to it, because this is a tough journey. We have to be there for each other, and we have to allow our friends and family to support us. It's very difficult for most of us to ask for help, but this is a time we do need to accept as much help as we can get. And I'm sure people who love you are just sitting there trying to just wait to help you. So accept this help and let them be a part of your journey. I did mention earlier about financial stress, and we have to make sure that you need to be cautious because there are promises that are made out there. Come to our clinic, we'll reverse your ALS. Please be cautious. Um, don't don't allow that to veer you in some direction, because if there was a magic pill, everybody would be taking it. There is none. And so I'm here to tell you, yes, there is a great role for functional medicine, but also a great role for integrating traditional and functional together. So use your gut and use your ability to make those decisions and talk it over with people that you know. I want to do just a quick slide on caregivers. Caregivers, and I know a lot of you are caregivers on this call as well. 70% of caregivers have depression. 51% have sleep deprivation, and over 40% have back pain because of what we do for our loved ones. It's very important to know this because caregivers tend to get chronic illnesses due to this emotional pain, trauma, physical issues that they go through. I don't normally share this, but I will on this call. I was diagnosed with cancer in 2019, 2 years after my husband was diagnosed. You see a picture of me and my sweetheart right there, where I had just gone through chemo and I have no hair on my head. And that's, I didn't know this about caregivers, or of course I knew this because I'm a physician. I always preached this to my patients, but I didn't listen to it myself. So after 2 years of no sleep, no self-care, no nutrition, no exercise, things happen. I don't want this to happen to you. So remember, caregiver fatigue is real. If you're not kind to yourself, if you don't nurture yourself, you cannot care for your loved one. So you too need to sleep and rest and meditate and exercise and eat healthy. Whatever you're doing for your loved one, you need to do for yourself as well. You've got to heal together. You need to try to take time away to recharge and rejuvenate. Never, ever, ever feel guilty for taking care of yourself. That is not a word that is in my dictionary any longer. And this is a tough lesson I had to learn, but I always like to say this because I think it's very important for all of us to be there for each other. And my husband is my biggest advocate, and he's the first person that tells me to go take care of myself. And I'm sure your loved one would want you to do the same. All right. So we have immense challenges with ALS, incredibly challenging condition. I would say, being in medicine for the last almost 30 years, it is the absolute worst disease I've ever seen in my entire life. And I think all of you would agree. Having said that, it's been it's just been a blessing. Everything has been a blessing. I'm not saying ALS is a blessing, but in some ways it has been. The whole journey has been a blessing. The cancer that I went through has been a blessing. The ALS diagnosis is something that has changed us. It's evolved us. It's evolved us spiritually, mentally, physically, with our relationships. I've met the most incredible people in my life. Some of you are on the call and you know who you are. I love working with these people, and I just have seen a side of this world and people that is just mind-blowing at how heartwarming people are and how giving people are. So there is some good that comes out of challenges. So remember that. Remember that one day you will look back on this and say, you know, I grew so much through this experience. It was the toughest thing I did. It was so difficult. It was so painful. There was so much grief, but there was also joy. And remember to have that joy. Remember to laugh with your loved ones. Remember to plan and do things. Don't just get caught up in these treatments and protocols and treatments. Do things. Live life on a daily basis. Sleep, rest, be good together. Honor yourself. Do your purpose. Just figure out what is your purpose. Don't wait until you're better. Just do it now. If there's something you want to do, even though you might have ALS or you're taking care of somebody with ALS, do it now. Live life now. And whatever you can't do on your own, use technology to improve your quality of life. This is very, very important. I hope you really take this to heart, because this comes after 7 years of going through this journey. These are some of our pictures of these wonderful moments that we've had, where we've, gone through different things, celebrated my kids' different milestone birthdays, and my husband's been able to see them graduate from high school and go into college and New Year's celebrations and travels. We've tried really, really hard to do everything we can to live each day. And I really, really encourage you guys to do the same thing. So I'll leave you with this one, a couple of slides here, and that is, you're in this, you're in it, you're here because you're in it. Get involved. Healing is helped by purpose, by passion, and by giving back. At least for us, it was a huge part of what we did. Making an impact is very important to us, as I am sure it is important to you. So if there are patient advisory boards, please join them. Get your voice heard. If there's local, regional, national awareness campaigns where you can create some, please do so. A couple of the organizations that I'd like to just mention that I want you to consider getting to be a part of, as well as take advantage of their services. First one I'm going to say is Compassionate Care for ALS. Shout out to Ron, Hoffman, James, their team. They have great gatherings. They provide equipment, retreat centers, so much help, so much support. Please go to their website if you haven't already. Everything ALS, Indu and her team does a lot of virtual educational events that I think that you would definitely benefit from to just stay on top of what's going on in the ALS world. ALS One, Jen and her team, they do great symposiums and great collaborations with other organizations and really promote research. ALS Heroes, which is our foundation, and we focus on repair and regeneration, neurotechnology, quality of life. And then Team Gleason, if you need any technology assistance, please contact them, and they would be more than happy to help you in any way to improve your quality of life. So please get involved with any and all of these organizations, because this is what we did, and this made our life just more purposeful. And we were able to then do more because we felt like we could, and everything was not just for nothing. So like I said, we focus on research and advocacy, repair and regeneration, neurotechnology, quality of care, something that we've done that James already mentioned. We have awards that we have endowed and we give every year for repair and regeneration, because I remember this conversation that I had with Merritt many years ago, at least about 4 years ago, if not more, that I appreciate everything that's being done for slowing down the progression, and I want to support that research as much as possible. But what are we doing to repair and regenerate and reverse the function that so many of our loved ones have already lost? What are we doing to regain that function? And that's where this entire award came from, where we have tried to identify global researchers that work on areas that actually lead to repairing axons and neurons and regain function. And so there's a lot going on, I'm happy to report. And if you haven't heard already, there was a research that just got our award last year where the F.A.C.O.G gene, there was a young lady about 12 years old that went from being trached and not being able to walk and is now able to walk. And you should look at some of the videos, they're so heartwarming, who has ALS and was able to walk again and be able to do so many things again on her own. And it truly looks like incredible, incredible work. If any of your kids are interested, they should be getting involved, because that is a way for your kids to heal. I always say, when you have a devastating diagnosis or something horrible happens in your life, a traumatic event, young people, and our kids were 13 and 16 when this started, and they are now 20 and 23. Young people can go one of two ways. They can either take it and create the most amazing passion out of it and make the most amazing impact, or they can really go the other way and it becomes very devastating. Through a lot of the work that we were able to do, I am so blessed and so grateful that our kids decided to make it into a passion. And this is a TEDx talk. If any of you are interested in a tearjerker, you should definitely watch it. It's my daughter Zoe back when she was 17. Definitely get involved in walks in your area. Definitely get your kids involved in their schools to do different campaigns. Get on the TV if you have the ability to do so, to try to create awareness for ALS, to try to create more and more ways to really, really get people excited and to let people know how devastating this illness is. And it's not an orphan disease. It is affecting so many people around the world, and we really need their help. Again, educate yourself. There's a podcast, if you're interested, on drshelinstitute.com, where I interviewed Dr. CCALS, and there's some updates on ALS on there. This hour is not long enough for me to share all the information that we've learned in 7 years, but I did my best to try to give you as much as I could possibly give you, and to really allow you to focus your care, your attention, your mind, and your body in a state of healing rather than staying in a state of hopelessness. There is hope for us, because behind the deepest wound is the doorway to the greatest gift. And if any of you have any other questions that we can't respond to today, please feel free to contact my office, and we'll do our best to help you in any way. Thank you so much. And thank you for having me today, Ron and James.
Thank you, Dr. Shel. We're going to stay on for a while and allow time for some Q&A. If you can stay for a while, Dr. Shel. There's quite a few in the chat already that we could start to go through. Ron, did you have anything you wanted to add at this time?
Yeah, first for the Q&A, because we are over a little bit, if it can be kind of succinct, James, peel through them. Everyone know, and there was a message printed earlier, soon as possible, this will be up on our website. So you'll have an opportunity to review, because there was a great deal of information. And then when we're finished, James, I do have a few words. Go ahead.
Okay, great. So our first couple of questions from Lisa. She's wondering if you have an opinion about Vibrant Diagnostics.
Vibrant is usually a lab that we might use if we need to do things virtually and send things out. I think it's fine. I wouldn't start doing diagnostics without knowing that you really need to, because again, then you're spending a lot of money potentially unnecessarily. As a lab is fine, but doing something with some guidance, with somebody who knows how to interpret the data, is also very important.
Thank you. Another question from Lisa is she's wondering if motor neurons can be regenerated. She's heard some people say they can be, others say they cannot be.
That is a very good question. So I truly believe, and this is just my personal belief, that there is great potential in this field. And can they be? Eventually, we hope that they can. We also don't know whether the motor neurons in ALS patients are they completely dead, completely gone, or are they just dormant? Are they atretic? So we're trying to figure a lot of that out. A lot of autopsy results have shown that there are motor neurons that are remaining. So can we get the motor neurons to start functioning again? That's the other question. So the work is ongoing in that field. There's no way that any of us can say a complete yes or a complete no, but a lot of the repair and regeneration work that we're supporting really is targeting towards motor neurons and axons. And I believe if you give the environment that you need in the body, in the brain, in the mind, then there is a possibility of regeneration. And a lot of stem cell work that's being done is really focused on that.
Great. Jen is wondering about foot and hand detox, what that entails.
Very easy process. You could even get one for the home, but essentially it's, our feet and our hand have the ability to get rid of a lot of the toxins. And so these are possibilities of detoxification that are not very expensive, that you can just purchase and have in your home and be able to detoxify. More than that, I prefer infrared saunas and light therapy, as well as some of the detox supplements that I mentioned. But these are simply different options that you can entertain if you don't have access to clinics and things of that nature.
Great, thank you. Diane is wondering, how do you do supplements and detox and things like that when your only food is through a tube?
Very good question. So just as you would orally, except you do a lot of crushing of tablets as well as capsules. So capsules are great as long as they're not sustained release. You can crush them or you can open the capsules. My husband has a PEG tube, and we've been doing this for years and years through the feeding tube. Also, it's very important to remember that if you've got a feeding tube, please know that there are ways to get the right nutrients in, and you don't have to use the products that are sent to you with insurance or Medicare. You want to look at those ingredients because if you're trying to eat healthy and get the right foods in, there we usually for I guess as long as my husband's had a feeding tube, we've always made our food at home. And so there are some recipes that actually are on our ALS Heroes website. My son is now a nutrition major, so that's sort of what he handles, and that is what got him passionate into studying nutrition is my husband's entire journey and how to have nutrition go into your body, whether it's orally or through a feeding tube. So if you're looking for some recipes for smoothies or for feeding tubes, please go to the website ALS Heroes and you can access those. But to go back to your question, you can do essentially the same. You just can't do things like sublingual because, again, it's a different absorption, but you can crush, you can open capsules. Not a problem.
Great. Nadia says, wow, such great information. Thank you so much, Dr. Shel. Melody says, what a wonderful webinar. The doctor is making it so accessible. And she says, thank you, Ron and CCALS. Christine was wondering if we could see the gut balance slide again. I don't know if we can do that easily right now or not.
It'll be on the website.
We'll make it available. Can the slideshow be made available for people, Doctor?
It'll be on the website, I believe, right?
Yes.
Ron?
It'll be on this, so they can go watch.
Yeah, it'll be in the recording, so you can look at it again later. Let's see. What supplements do you recommend for a G tube? I think we just went over that.
Yeah.
Let's see. Wes is saying, thanks, Dr. Shel and Ron. Excellent information. Let's see. Which supplement companies? Steve says, which supplement companies do you recommend? I think I think you had that in the slideshow as well, right?
I don't think I did. I can tell you a couple different ones that I think are good. Pure Encapsulations is good. Douglas Laboratories is good. Designs for Health is good. Metagenics is good. Those are some of the ones that we use, and there's a handful of others. But again, just to reemphasize, all supplements are not created equal. So any of those, I think you'll do pretty well with. But certain supplements are best by certain companies, and that's the research that kind of we've done over time. And so you can also just go to my website and whatever I have, those are all research. So you can buy it from wherever, it doesn't matter, but you can look at them and learn from it.
Excellent. Diane says, thank you for this very informative webinar. Sabrina is, thank you, Dr. Shel, for everything. Moira says, thank you. Excellent. Sabrina, thank you, Ron. Here's a question from Christine. Do you have recommendations for severe gas, debilitating gas all day? None of the meds work. The gut motility.
It's motility.
Motility, okay. Is gone. It takes prescription meds, Marilex, Ducelex to get any movement. The gas buildup is painful all day. Do you have any thoughts about that?
Yes. What I would say is where there is gas, there is inflammation. And where there is inflammation, we need to actually get to the root cause. So using medications just to treat that is like putting a Band-Aid on something and not figuring out why do you have gas, so much gas, debilitating gas all day. It is your body telling you that I have a lot of inflammation and I'm trying to get rid of all these toxins. So, Christine, I would say that, go back and listen to the parts of the root cause of what you need to be looking at that might be causing the gut inflammation to begin with, and really starting there instead of taking more and more medications to just cover up what might be happening. And that just kind of goes back to figuring out the cause of what your symptoms are and really treating the cause and not just the symptoms. I hope that helped.
Good. Faith says, much gratitude to CCALS for this terrific program with realistic, actionable information. Lynn says, great talk. Lena, thank you. Thank you from Amy. Uh, the recording, Lena, will be available within a couple days on our website. So just go to the education library and it'll be down there. So very easy to find and should be up soon. Let's see. Melody says, so inspiring. Uh, Diane, is cannabis oil for spasticity taken by mouth or topical?
You can do it both ways. When I say by mouth, sublingual is better. So sublingual and topical, both would work well with that. But again, purity, sublingual,
Sublingual means under the tongue?
under the tongue. It'll absorb much better.
Okay, good. Azim says, thank you for a very, very informative session. Nizam says, great information. Uh, Jen says, Dr. Shel, you are amazing, truly fantastic. Doug is inspired, and thank you for fighting the fire and being our light. Uh, Susanna says, what is your opinion about quorum isosource formula?
I'd have to look at the ingredients. As far as a formula, and I'm not trying to make a general recommendation here, but if you're going to use a formula, one of the ones I like is Kate Farms. Kate Farms has a good peptide formula that I think does a pretty good job. To be honest, I'm not familiar with quorum, so I don't want to comment on something I'm not familiar with.
Okay. Shannon is wondering if there has been any correlation between COVID-19 illness and ALS onset.
No, I don't know if any studies are being actively done on that. So I, again, don't want to comment on that because there could be some kind of viral, retroviral, who knows, but really not sure. So
Okay,
I didn't want to, claim to
fair
know.
enough. Byron is wondering about the slides. They will be on in the recording, which will be on our website. Beth is wondering about ozone therapy. Does it help?
It could help. Ozone can be done in a few different ways. It can be done rectally. It can be done um, through your ears even, and it can be done in an IV. So could it help? It could, but I would be I would be very cautious. IV ozone should not be done by someone who doesn't have plenty of experience because, again, it can be a complicated process. And just be sure who you're going to, why you're doing it, why are they recommending it, and how much experience do they have.
Okay. Suzanne is saying we've had great success with Chrysalis Natural Medicine from Wilmington, Delaware. And Dr. Tolleson does telehealth, sells only top quality supplements. Amy is saying recently there is a neural stem cell in China called NRMSC. Almost 10 in my group tried it and they're regaining functions weekly. I really want to try it on my husband. Do you have any thoughts, Dr. Shel?
Um, Amy, I think it's going to have to be a decision that you make. Really make sure that you've looked at it up, up and down, inside out, and make sure that your body is ready for it and at the point of, completely toxin free and able to heal. That's all I can say because I don't know much about it. So again, I never like to comment on things that I haven't either experienced or researched myself.
Okay. Final question. It looks like here. Doug is asking, are Ensure Enrich the best way for quick swallow, easy weight gain? Unfortunately, my weight on insurance won't cover these things. Also, unfortunate sugar is not good. So anyway,
Well,
any
so
thoughts?
yeah, sure. I'm happy to comment on that. So you can ensure has a lot of stuff that you probably don't want in your body, but if you, it's a you're going to weigh the risk benefit ratio, right? So you're going to weigh, am I losing weight at such a rapid rate? And do I just want to get some weight on? But you want to get healthy weight on. So think about really healthy ways of putting that on, especially if you can make some feeds at home and it doesn't have to be expensive. You can use organic macadamia nuts. You can use full fat organic coconut milk. You can use dark chocolate for your antioxidants. There's a lot of things in the recipes that we've provided at no cost that you can do at home and get the same, if not more calories, and it's clean calories. So think about that, and it doesn't have to cost you an arm and a leg.
Excellent. Amy says, thank you, Dr. Shel, and that's where we will leave it. Ron, did you have anything you wanted to add?
Yeah, I do. Kate Farms, we have a lot of people on that. Likewise, we have a lot of our folks on Liquid Hope, high protein
Mhm.
peptide formula, which is another really, really good one.
It is.
Yeah, there was a whole lot of information here, and I mean, a whole lot. I want to, thank all of our families who showed up for this. I know sometimes this is really hard, whether it's Zoom or traveling. It can just be really difficult. So thanks for the response. I want to thank some good friends, partners, colleagues of mine. I know Dr. Shukovitz from the Healy Clinic was on. We go back, my goodness, 26 years. Likewise, Jen DiMartino from ALS1. Thanks for being here, Jen. And thanks for all that both of them do. And most importantly, to my good friend, Dr. Shel, thank you for everything. Folks, again, this will be on our website. Many of our staff were on. Thanks, guys, for being here. And yeah, reach out to us. Our website is at ccals.org. If there are any families out there that aren't familiar with us, I really invite you to check us out. There's really nothing in the ALS experience that you are in that there's not something that we can bring to the table for you. And just huge appreciation for everyone. So thank you, Dr. Shel. See you soon.
It's my pleasure, Ron. Great seeing you, and thanks for all the great work that you guys do. And to everybody who's listening, thank you for being you, and just keep the fight going. We'll get there together.
Thanks, everybody.
Bye
Thank
bye.
you, James.
Thank you.